The cool thing is you actually do get changes in the tissue. It creates a histamine response, which changes the tissue and then changes how your brain senses the area. All right, so we got Dr. Bandemer here. She's been kicking her own butt playing rugby. She had a pretty cool eye gouge injury over the weekend, but definitely go check out her, I think, her social media there. Face wounds always look worse than they are. They just bleed like crazy. So we're doing some dry needling on her traps. She beats herself up all the time in the gym, at work, and on the field. So we're trying to find some good trigger points. And then we're just gonna kind of pinch the trap here. And we just take a needle and try and find that trigger point. Go right through. There's a couple different ways that people do dry needling. The way I learned it and like to do it is to kind of poke around, try and find resistance in the muscle. It almost feels like thick. They run through there. That's pretty sticky. So then the cool thing is we can spin the needle and then it wraps around some of the scar tissue or the adhesion in the muscle. And then eventually I can't turn it anymore like a screw, like into wood. And then I have a hard time pulling it out. So once we wrap around some of those fibers, we spin the needle and we can't pull it out anymore. You can see how it's tenting there. So you can spin a little bit more. Sometimes it's a little sore, but then once it releases and it comes back out, that means we broke up some of that scar tissue in there. Another way they do dry needling is just kind of put the needle in and kind of leave it, similar to acupuncture, but it's just not following any energy flow or meridians. So see, I can't really pull that out. How does that feel there? Is it sore or do you feel anything at all?
That's a little bit sore. But yeah, it didn't feel like anything initially.
Yeah. Sometimes it's sore, sometimes it's not, but that's how we do it. So the big question I get with dry needling is what's the difference between dry needling and acupuncture? So acupuncture is like a Western or Eastern Chinese medicine. You're following kind of theoretical analysis of whatever method. So sometimes they use the weather, sometimes they use astronomy. Some they just kind of feel what's going on. There's really no rhyme or reason. It's not reproducible. It's just kind of practitioner dependent, as far as my understanding. The cool thing is you actually do get changes in the tissue. It creates a histamine response, which changes the tissue and then changes how your brain senses the area. That's typically how acupuncture works. Dry needling is more mechanical, more Western. Find a trigger point, stab it, release it, and move on. So that feels a little bit looser there. Sometimes it bleeds. Sometimes it's sore after, which I would expect. Like I said, some ways people do dry needling is just kind of find the trigger point, stab it, and leave it. Sometimes people will piston it up and down, kind of do this to get those muscle fibers or spindles to relax. You get a bit of a twitch response, and then it relaxes that way. And I like doing the kind of screw method where you turn it, can't pull it out, and then eventually it releases. So what you do too is you unscrew it in the opposite direction, and that relaxes some of the fibers too. So you can spin in there, and you can see how it doesn't want to spin anymore. You try and pull it out, it's stuck, and we do it that way. I've had some patients where there's been so much gunk and scar tissue, I've actually pulled some out and it kind of looks like cobwebs. That was pretty interesting. And sometimes when the needle gets a little dull, it starts to bow. And around here, I'm not worried about puncturing her lungs because this muscle's pretty thick. The lungs are really far in. You're not going to hit any nerves back here either because they're all in the front of the neck and shoulder. Sometimes you get a referral pattern going down the arm, but again, it's just a referral. It's not actual damage or pinching off on a nerve or touching a nerve. So there's another good one. You can't pull it out, so we unscrew it. There we go. And sometimes too what will happen is you get a bit of a histamine response around that area where it starts to like bow up like a pimple or get white around there. That's a good thing. We want those histamine reactions. And then we'll try the other side. Feel it right there?
Yeah.
And you can kind of see where the needles went in. There's a little bit of like histamine swelling, super small right there. Yeah, luckily no bleeders, so that's good. But
Nice.
even if it is, it stops in 2 seconds.